Hello, and thank you for watching. My name is Jessica, and I'm the lead moderator of the Facebook group Demand Change and Keep the Receipts. Our goal is to provide information and fact-based arguments that we can use to contact our representatives and demand practical policy change. Our receipts are our sources and any record of our communications. To that end, I've included the sources I used for this video in the last two slides. There is also a link to a copy of the PowerPoint in the description, and that includes image descriptions that should be accessible by reading programs. If you need any other accommodations to fully access this information, please leave a comment or send me a message and I'll do my best to address it. In this video, we will be wrapping up our review of the ad Signs, which is brought to you by One Nation America. There are videos introducing both the Koch brothers and One Nation America, and a video for fact-checking the claim that 180 million people will lose private insurance with Medicare for All that goes over who made the claim and how accurate it is. There are overview slides in this presentation, and we'll be doing a final recap at the end, but I recommend starting there if you haven't had a chance to look at those yet. If you have, thanks for sticking with me. There's been a lot to unpack for a 30-second ad, but healthcare is a complicated subject, and I want to make sure to fact-check everything and make sure that the context is fully represented. We'll be finishing up this review by checking the accuracy of the wait times and going over background information that might be important. Make sure you're comfortable, you've got a drink, maybe some snacks, and we'll get started. On this slide, you'll see a table with all of the wait times that are presented in this video, along with my issue with them in a bright red box. They are what I would describe as critically incomplete. In the past, the Fraser Institute has provided factually correct information presented with a conservative bias, but there's honestly not enough here for me to fact check and compare to our current system. Most of them aren't specific as to the type of procedure, and there's no indication of the urgency. For example, let's take this first claim. Heart surgery, 10 weeks. In review of the study, it does specify that there are specialist appointments, not general appointments, and that's something, but what type of heart surgery is it? The American Heart Association lists 9 procedures on their website, and I'm sure that each one can be split into a myriad of other more specific types of procedures that each require their own specialists and may have different wait times. This type of surgery could also help determine the urgency, which has a big impact on the wait time. One of the things in the Fraser Institute study, and supported by several other sources that I found, Canadians do not have to wait for urgent medical issues. About 43% of them can get same-day or next-day appointments, and there are still walk-in emergency rooms. On the other hand, 77% of Netherlands citizens and 67% of Australian citizens can get an appointment same day or next day, and they both have version of socialized medicine as well. People on both the right and the left like to use Canada as an example, but it's not actually the pinnacle of the single-payer experience. Their wait times are some of the highest, and I feel like that's important to note when we're discussing how wait times could potentially change in America if we switch to single-payer care. Even here, currently about 51% of patients can get same-day or next-day urgent appointments, and there are considerable insurance hang-ups to deal with. To get an idea of how these hang-ups cause delays, let's take a look at the life cycle of the wild insurance claim. You start with an appointment with your general care physician, and they have to give you a referral. Once you get the referral, you have to find a doctor in your network. When you find a doctor in your network, they may have to confirm that it's medically necessary, which also has to be reviewed by an insurance company's board. This all takes time that doesn't necessarily reflect in the waiting period between when our primary physician says we need to go to a specialist and when we get to see them. What that all means is that I won't be able to do a line-by-line breakdown and comparison. However, we have to start somewhere, so let's at least look at some high-level numbers and get an idea of how the Canadian wait times are versus US wait times. The average wait time to see a specialist in Canada is about 8.3 weeks or 58 days, and it varies by location. Bigger cities have longer wait times. The sort of average for the US is 24 days, and it varies both by location and by the type of appointment. A first appointment usually takes about 32 days, whereas checkups are 20 to 24 days. So, to be fair, that's about half the wait time or less, assuming that Canada is the bar. But for the sake of argument, let's say that we switched to single-payer system that ended up being on the back of the bell curve with Canada regarding wait times. What now? Well, the Fraser Institute study used for this ad also shows that because urgent care is addressed based on need, waits don't generally result in any negative impacts to a person's health. Conversely, about 64% of Americans delay treatment, sometimes urgent treatment, because of concerns about the costs. I won't go into the full details again, but studies have shown that delaying even regular preventative care can impact long-term health, and delaying urgent or emergency care result in higher rates of being admitted to the emergency room and higher rates of mortality. There is also a phrase that I found floating around among doctors called financial toxicity, and it's about what it sounds like. Even if the patient has been provided all the best possible care and has the best possible chance of recovery, financial stress can hinder that process. On the subject of finances, one of the big concerns that I usually see regarding single-payer health insurance is the cost by way of taxes. I've got a couple of different sources, and they all say that take-home for Canadians isn't that much lower than the US. One study said that it was a difference of 0.1%, though I have also seen that it varies, so this is probably best case scenario. But without single payer and without other types of cost controls, Americans pay many, many times more for the same quality of care. On a national level, medical spending in Canada is about 11.7% of their gross domestic product, whereas in America, it's about 17.9%. I do want to be honest, and I'll bring up again that the Canadian health insurance system isn't perfect. While it covers what they describe as medically necessary procedures, that varies based on province and it doesn't cover prescriptions. That's generally where their private insurance sector comes in, and not everyone can afford it. South of the border, Americans have no guaranteed coverage for medical necessities, and even with insurance, there may not be coverage for prescriptions. Based on this information, it looks like we're saving pennies on the front, and it's costing thousands of dollars and potentially up to 29,000 people per year who die without care. This is really heavy, and I just want to thank everyone for getting this far. If you need to, pause the video, refresh your drink and snacks, stretch a little, come back, hang in there, we're almost done. The last thing I want to do is go over specifically what we pay for shorter wait times. All set? Good deal. For the same claims, sometimes narrowed down to a specific treatment if needed, I've compiled a list of how much Canadians pay versus how much Americans pay, and it looks a bit like the markup on fountain drinks. Full disclosure, I wasn't able to find the prices for all of these procedures in Canada, and not all that I could find was current. I don't know that I want to call this a problem per se, but there's not as much reporting on price because there's not as much of a customer-facing price. Especially in the case of, say, brain surgery, it may be that they almost all fall under the life-saving treatment and the patient doesn't see the cost to report it. The ones that I found that were out of date, I tried to adjust up for inflation to make it as fair as possible. If you have more current information, please let me know and I'll be happy to update my chart. But using the topmost numbers of what I was able to find, it breaks down like this. To pick one heart surgery, a bypass surgery in Canada is about 8.4% of a cost of a bypass in the US. An MRI can cost 5.6% of the cost in America. Per year, the cost of asthma is about 11.5% of the cost of care in America. Cataract surgery is about 7% of the cost. Hip replacement and ultrasounds are a little more at 18% and 59% respectively, but I want to talk about cancer in a little more detail. Like heart surgery, there are a lot of different types of cancer and a lot of treatments that can change the price by an enormous amount. Based on the averages, the cost is a little less than half the price in monthly prescriptions and a little less than a third of the cost overall in Canada. But one thing that I thought was interesting is that the article found for the cost of cancer care in Canada is that there is an upper cost of about $75,000, and it seems like that's the cost for rare, hard to treat terminal cancer, the worst of the worst. I wasn't able to find an upper cost in America. I looked, and the closest thing that I could find is that it could cost up to $60,000 per month. That means the end cost depends entirely on how long the treatment goes. 2 months of treatment are more than a house in many places. If you consider that insurance could pay 80% of the treatment, that's still a crippling bill. According to the Journal of National Cancer Institute, over half of cancer patients lose their homes. There are bankruptcies in Canada that are related to health events, but it usually has more to do with missed work, and this isn't a video discussing short-term disability benefits. Regarding what we did discuss, let's recap. This video is brought to you by One Nation America, citing the Fraser Institute, and both are funded by the Koch brothers. They all have hardline conservative beliefs, and they have been known to share accurate facts presented in a biased way. The claim 180 million people will lose private insurance with Medicare for all is honestly pretty lazy. Not totally accurate, and mostly lazy. A little more research would have shown that the number is only for adults from 18 to 64, and there's another 37 million with private insurance if you count kids. But there are also 30 million adults and children with no insurance at all, and that has a big effect on their life expectancy. Ensuring everyone with single payer would help prevent thousands of deaths each year, and it's likely that there would still be private supplemental insurance to help cover out-of-pocket expenses. So it would be a change, but private insurance wouldn't be gone altogether. It also makes several individual claims regarding the wait times in Canada, but there was no good way to confirm the accuracy due to how non-specific it was. At a high level, wait times are considerably higher for regular and preventative care, but there are still emergency rooms like in the US, and 43% of people with urgent but not emergency issues can see a doctor either the same day or the next day. There are also no delayed or skipped appointments due to either fighting with insurance or inability to afford treatment. Canadian insurance doesn't cover prescriptions, but even so, overall treatment costs are a fraction of the cost of treatment in America for the same quality of care. Overall, I'm going to give this ad a potato out of 10. It means something. It's accurate to say that there is a potato, but there's no context, and it only really makes sense if I do a small series of videos explaining it. Joking aside, I hope this has given you some insight about the ad and maybe the healthcare debate in general. It's a hot topic and there are a lot of false claims going around, and I want you to be able to decide the best solution, whatever your decision is, fully informed. And if you see an ad with a simple tagline on a complicated issue, I hope it's just a jumping off point to research who made the claim, how accurate it is, and what the context is. If there's an ad in your area that you would like me to check, please let me know. In the meantime, thank you for watching. This is Jessica, and this has been Demand Change and Keep the Receipts.